Radiation therapy is a common treatment for cancer, but often leads to tightness and thickened or hardened muscles and tissues. My name is Kelly, and I am an oncology physical therapist and a certified lymphedema therapist. And in this video, I'm going to share with you my 3 go-to stretches to improve shoulder motion after breast cancer surgery. Before we begin, make sure you subscribe down below for weekly new videos. You can also join us on Instagram for more related content, and you can check out our website for more resources. Radiation fibrosis is a side effect that can linger on for months to years after radiation is completed. This is when the tissue, including muscles, tendons, ligaments, skin, and more, are damaged, hardened, or scarred in the area that was radiated. The exact cause of radiation fibrosis and other side effects of radiation are not fully understood. It is thought to be related to the damage that radiation therapy can cause to the cells and tissues in that area. It's common to see high incidence of side effects with higher doses or longer treatments of radiation compared to someone who may have only had a few sessions with a low dose. However, there is a genetic piece of the puzzle as well, and some are simply more prone to tissue and skin damage than others. This damage from the radiation can lead to formation of scar tissue, which can cause stiffness and a loss of function. Now, there are 4 main treatments for helping to manage and improve radiation fibrosis to minimize its effects long term. So let's talk about each of these. The first is stretches. Stretching the muscles and tendons in a gentle way, but with the correct and a longer hold, can be crucial to help muscles maintain their length and then minimize that tightness. Radiation fibrosis builds up like scar tissue, so the sooner these are started, the better. Stretches should focus in on muscles that are affected, like the pec muscles in the front of the chest, the lat muscles on the side of the body, and even into the neck and into the rotator cuff muscles of the shoulder. The tightness that can occur can be painful, and it can lead to misalignment of the shoulder joint, the neck, and then lead to poor posture because of that tightness, putting someone at risk for injuries of their shoulder or their neck long term. To stretch a muscle that was in the radiated field, we want to hold these for 30 seconds to 2 minutes. But we want to keep them very gentle and well tolerated. So we don't want to bounce on the stretches, we don't want to strain too much, or we shouldn't have any pain during these. Another treatment option for radiation fibrosis with that tightness and pain is manual therapy. So hands-on techniques and manual therapy are very important combined with the stretches. This may be like a massage-like movement, myofascial release, and then there's other therapy techniques too that are hands-on. So radiation fibrosis is like scar tissue, and although stretching, like we talked about, does help elongate fibers that are tight, the manual therapy options can help soften and gently break up this fibrosis. These aren't deep, intensive techniques because it's really important to avoid adding more inflammation to an area, which can cause further damage. But even 5 or 10 minutes a day of doing this specific massage-like technique with certain sequences and techniques can be very beneficial in reducing and managing that fibrosis. So things that are like tissue rolling, where we want to think about just gently kneading dough, like when we're kneading the tissue to help soften it. We're just doing scar releases as well, tissue rolling, and then other techniques as well. Doing 5 to 10 minutes on that area, nice and gentle, can really help soften the fibrosis. Now, if you'd like to learn these specific techniques and go more in depth on how to reduce fibrosis, then you'll definitely want to check out my breast cancer rehab program. For years, I saw how little guidance and support there really was for women and men through breast cancer or just cancer treatment. And all of these issues like pain and fibrosis were lingering on for months, years, or even decades for some. And I work with individuals each day who have these issues, and I wanted to bring them all forward to everyone. So I created a full program for breast cancer recovery, and they really address every component. So it addresses lymphedema and reducing the risk of getting lymphedema, range of motion, getting someone's mobility back, and reducing pain. And I specifically have a section on rehab after radiation that goes in depth on all the stretches and strength exercise, as well as a lot of these hands-on manual techniques that someone can follow along with step by step to really see what works best for them. So someone can get the full program, or if someone just needs a component of it, you can also just get each section separately as well. So to learn more, you can check this out on my website, which I will link in the description box down below, as well as up above. Another way to address radiation fibrosis is skin care. So skin care is necessary during, but also after radiation. The skin was damaged, so some may have blistering, burns, or other skin changes, along with that inflammation and sensitivity. The fibrosis can thicken tissue, but it can also make it really fragile and sensitive. So using the lotion your radiation oncologist prescribed or recommended is necessary for weeks to months after. Some may even recommend using it for a year or two after radiation. Each doctor is a little bit different, but looking at what your doctor says for your optimal health. It's also best to avoid lotions or moisturizers that have perfumes or alcohols in them, as this can dry out the skin further. Some may also recommend coconut oil or just basic Vaseline. Again, each doctor is different. We want to make sure that we follow your doctor's recommendations for you. And another treatment for radiation fibrosis and that tightness that can occur with it is movement. So along with the last three we spoke about, movement and exercise are just as beneficial in managing fibrosis. It doesn't have to be intensive, but light movement even and physical activity can encourage blood flow to that area, which helps promote healing. We want to make sure that we start low and slow with any new exercises to also avoid inflammation or adding more inflammation. That can worsen symptoms. So gentle and light movement can just help support healing and overall tissue health. And those are the four main ways to help manage and treat radiation fibrosis to improve tightness and pain, as well as tissue health long term. To learn specific stretches, exercises, and those manual techniques for home, be sure to check out the link in the description box for the breast cancer rehab program, or just head on over to my website at 𝐿cancerrehabpt.com. But other than that, I hope you all found this video helpful, and we'll see you all in the next video. Thanks, everyone.